I've been told my joints are unstable or that I have some sort of hypermobility. But how do I actually know if that's true? Hi, I'm Dr. Justin Lim, Doctor of Physical Therapy at Rehab and Revive, and we're going to get to that answer right now. But first, real quick, please take a few seconds to like this video and subscribe. If you found this video helpful, consider hitting the thanks button and donating to support the channel. Our team has also worked hard to bring our professional exercise programs to you at home. You can find the link to our Revive at Home programs in the description box below. We truly appreciate the support. All right, let's talk about hypermobility and joint instability. These terms get thrown around a lot, but they're often used incorrectly. Here's the simplest way to think about it. Your joints are like door hinges. A healthy hinge opens, closes, and stays centered. A hypermobile joint, that hinge opens too far, it wobbles, and it never quite feels solid. Now, here's the key difference most people miss. Hypermobility is not the same thing as flexibility. Flexibility is being able to move through a range and come back home safely. Hypermobility is movement without control. And that's where the problems start. So how do you know if this actually applies to you? Here are some common things I hear in the clinic. Something just feels loose. My joints pop or shifts, it doesn't just crack. My pain seems to move around. I stretch all the time, but the tension always comes back. If stretching feels amazing in the moment, but you actually feel worse later that day, that's a huge clue. Think of their ligaments like softer rubber bands, but a lot of the people develop instability over time through repeated injuries, sitting too much, or even training for flexibility without building the strength to support it. Little by little, the screws on the hinge just loosen up. People always ask me, are there tests for this? In the clinic, we use things like the Beighton Score. We look at whether your elbows lock backward, your knees hyperextend, or if your thumbs can touch your forearm. But here's the honest truth. The test matters far less than how you move. If your joints move easily, but you struggle to control them when you're carrying groceries or working out, that's instability. Now, how do you actually get better? This is where most people go wrong. You do not fix joint instability by stretching more. That's like trying to fix a wobbly ladder by making it longer. Instead, you have to retrain control. We focus on a few specific things. Teaching your nervous system where center is. Training stability in the mid-range of your movement, not the very end. Building reflexive strength that protects the joint before you even think about it. When we do this right, patients tell me, I feel tighter, but I move better. That's not stiffness, that's security. The takeaway I want you to remember is this. Hypermobility is not a life sentence. It's a management problem, not a damage problem. With the right approach, you can become stronger, more stable, and way more confident in your body. If this helped clarify things for you, leave us some love or questions in the comments box below. Please like and subscribe. We truly appreciate your support. I'm Dr. Justin Lin, and remember, we heal smarter.